Welcome to Elevate Wellness Group. I'm Gil. I'm the director at Elevate Wellness, and we're diving into the landmark Traverse trial. If you treat aging men, managing testosterone deficiency has been, well, let's just call it what it is. It's been met with some really complex risk benefit calculations for years. But today, we're going to definitively address the long term safety of testosterone replacement therapy by unpacking the massive data set from Traverse. We're going to get you a direct, crystal clear understanding of exactly what this trial means for you and your patients. For years, this single critical question has created a massive medical legal dilemma. It's caused major anxiety for patients and total hesitation for prescribing providers. Is treating functional hypogonadism actually putting a patient's heart at risk? Today, we're looking past all of the speculation and we're zooming right in on the hard clinical data to see exactly what the reality is and put this long-standing debate to rest once and for all. All right, here's our clinical roadmap for today's briefing. We've got one. The TRT safety controversy. 2. Designing the Traverse trial. 3. MACE, cardiovascular safety findings. 4. Prostate events and cancer. And finally, 5. Clinical takeaways for practice. Okay, let's jump right into section 1, the TRT safety controversy. We really need to contextualize the clinical dilemma that left prescribing physicians stuck in this massive gray area. The anxiety really started to hit a boiling point in the early 2010s. We saw these early, incredibly heavily debated observational studies. You might remember the TOM study back in 2010 and the VIGIN study in 2013 that flagged some potential adverse cardiovascular events. And this all culminated in 2015 when the US FDA made a huge move, placing a literal black box warning on all testosterone products because of these cardiovascular concerns. That FDA decision created an immediate global fracture in the medical consensus. In a pretty striking contradiction, while the FDA was sounding the alarm, the European Medicines Agency reviewed the exact same evidence base and found absolutely no cause for concern. None. You can imagine the nightmare this created for routine patient care. Guidelines were completely at odds depending on what side of the Atlantic you were practicing on. Moving on to section 2, designing the Traverse trial. To resolve this impossible global split, the FDA requested a definitive large-scale study. And they did not take the easy route with this one. Notice the sheer rigor of the trial design. They enrolled over 5,000 older men aged 45 to 80 with confirmed low fasting testosterone and reported symptoms of hypogonadism. But here's the crucial part. These men had pre-existing or very high risk of cardiovascular disease. They explicitly tested testosterone therapy in the exact vulnerable population that everyone was so worried about. The study was set up as a multi-center, randomized, double-blind, placebo-controlled, non-inferiority trial. Patients got either a daily transdermal testosterone gel, dose-adjusted to maintain normal levels, of course, or a placebo, and they were followed for an average of over 27 months. That non-inferiority design is the key. The whole goal was specifically to prove that TRT did not unacceptably increase the risk of major cardiac events compared to doing nothing. Now let's get to the good stuff. Section 3, MACE, cardiovascular safety findings. Let's look at the highly anticipated primary endpoint results. 0.96. This is the number that changes everything. The trial delivered a decisive hazard ratio of 0.96 for MACE. In statistical terms, because the upper bound of the confidence interval was well below the non-inferiority margin, this means testosterone replacement therapy was entirely non-inferior to the placebo. Simply put, the risk was not increased. When you break down the data, it's amazing how consistently it proves the safety profile. Across all the on-treatment sensitivity analyses, the results cluster tightly around the line of unity. This firmly, definitively establishes that TRT did not increase the risk of composite endpoint cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke. Over a span of 48 months, the cumulative incidence rates for the testosterone group and the placebo group are practically intertwined. With a highly significant p-value for non-inferiority of less than 0.001, the long-term data proves that the cardiovascular fear surrounding appropriately prescribed TRT was completely unfounded. And get this, if we look really closely at the numbers, there was actually a small reduction in overall mortality for the guys on testosterone therapy, specifically 16 fewer deaths within the treatment group. Now, sure, this difference is statistically non-significant, but it is an incredibly reassuring data point. Given all those historic fears of TRT being inherently dangerous to aging men. All right, section 4, prostate events and cancer. Because we all know if doctors weren't worried about the heart, they were definitely worried about the prostate. Looking at the data for prostate-related events, the incidence of high-grade prostate cancer was exceptionally low across the board. There were only 5 cases in the entire TRT group compared to 3 cases in the placebo group. Statistically speaking, the incidence of high-grade or really any prostate cancer was remarkably similar between the treated and the untreated cohorts. And beyond cancer, the trial monitored functional prostate and urinary issues too. TRT showed absolutely no worsening of lower urinary tract symptoms, also known as LUTS. There were equal rates of invasive procedures for benign prostatic hyperplasia and 0 increase in acute urinary retention compared to the placebo group. The prostate safety profile was thoroughly, unequivocally established. Which brings us to section 5, clinical takeaways for practice. The crucial point here is, how does all this statistical data translate directly into your decision-making in the exam room? Historically, because of the fear of prostate complications, guidelines were incredibly strict. For example, the European Association of Urology suggested some intense prostate monitoring. They wanted a digital rectal exam, or DRE, before starting TRT, and again within 3 to 6 months. And then again after 12 months. That is potentially 3 invasive exams in the first year of treatment alone. But then, conversely, guidelines from the Society for Endocrinology stated that routine DREs weren't even necessary, bluntly noting that endocrinologists are not urological experts. Talk about an inter-specialty tug of war. It trapped prescribing physicians in these conflicting guidelines, creating a major barrier to prescribing a potentially beneficial therapy. And honestly, just a logical nightmare for patient management. Well, the robust prostate safety profile from the TRAVERSE trial acts as the definitive tiebreaker. The data strongly supports the view that routine DRE screening solely because a patient is initiating testosterone therapy is unnecessary. While regular PSA testing and general men's health screening should continue as normal, TRT itself does not mandate a hyper-aggressive schedule of rectal exams unless clinically indicated for other reasons. Ultimately, the TRAVERSE trial removes the major historical barriers that have loomed over this field for over a decade. It confirms, with the backing of a massive, incredibly rigorous data set, that appropriately prescribed TRT designed to achieve normal physiological ranges is unequivocally safe for both the heart and the prostate. This data represents a true paradigm shift. It absolutely empowers you to treat your symptomatic hypogonadal patients with clinical confidence, completely without the shadow of the FDA black box warning dictating your practice out of fear. So this leaves us with a final thought to consider. With these barriers decisively removed, How will you apply this newfound clarity in your exam room tomorrow? Thank you for joining me on this episode of Elevate Wellness. I really hope this deep dive into the Traverse trial has been illuminating. Thanks so much for joining me. If you would like to learn more about working with us towards your optimization goals, please visit us at elevatewellnessgroup.com.